Hello, my name is Dr. David Kulla. I'm here today to do another product review, and make sure you check out all my other product reviews on our product review playlist. But this is our first review we're doing on a laser. A lot of people have been asking me to do a review on a laser that is affordable. This is just above $100, it's about $130. Check my description in the video, so if there's any discounts available, we'll certainly put them down there. So I would say $130 would be affordable, right? Now, you gotta be careful when you say affordable because you get what you pay for in some cases, okay? So you can buy all sorts of affordable lasers on Amazon and different places. This here you can get on Amazon. This is called the LasePreht, okay? And this laser, a couple of odd things for me. The name of the laser, the brand isn't on the box, but their service is good. Every time I've emailed them, they have gotten back to me and responded very quickly. The other thing is the brochure has a lot of acupuncture points. I mean, I've got a few issues on that. Number one, if I'm treating, for example, arthritis in the knee, they have points below the knee, which is fine, and above the knee I would think would be even more important for blood flow from the femoral artery and other arteries in the hip region down, in the upper thigh down. So they didn't have those listed, so it's more acupuncture points. And for me, if I have arthritis in my knee, I'm gonna laser right over the arthritis, right over those points. Call them points, call them whatever you want, but right where the arthritis is and around that joint, all around that joint. So if you have a diffuse arthritis, osteoarthritis in the knee, you would want to do it all around the joint, behind, in front, on top, bottom, on the sides, from different angles, okay? So that being said, this laser, it shows you some diagrams here, which is nice, of collagen production, and I would say that this probably does that, okay? Neovascularization, which is increased oxygenated blood to the injured tissue, which accelerates tissue healing. Yes, certain lasers have been known to do that. Now, when we talk lasers, there's a whole wide spectrum of wavelengths, and this is really important for you people to know this before you go and buy a laser and have no clue what you're doing. So when you're talking about lasers, there's really a few spectrums, right? Let's make it simple here. First, you have red light therapy. Red light therapy is gonna work more on the surface of the skin, okay? And psoriasis, eczema, maybe wrinkles, collagen production, things like that. It's not gonna work down to muscle regeneration or anything like that, or get down to that muscular level. Now, red light therapy is in the 600 nanometer range, right? So this has 13 650 nanometer lasers in it, okay? You may see my cat here join us, my little kitten actually. This is Tigger, so you could just ignore him. He's cute though. So at 13 pieces of 650 nanometers, that's pretty good. It's a continuous laser, and I'm gonna get to that in a minute. Now, it also has 4 pieces of 808 nanometer. Now, 808 nanometer is a wavelength that will go deeper, and that wavelength would be in the near infrared. Okay, and we're still not really talking about laser here yet, right? Near infrared, yeah, it's red, the light is red, but you won't see them on here. So the 4 pieces are in the middle and you won't really see them light up because they're beyond the visible eye. You don't see anything light up on those 4 diodes. Now, that being said, these are continuous lasers. This laser here, the lasers are not superpulse, they're continuous. And it really depends on the wavelength of the lasers that you're dealing with. So the 4 in the center are 808 nanometer. They're gonna penetrate a little bit deeper, but that's near infrared, right? So when I say a little bit deeper, maybe a little bit of increased blood flow, also collagen production, oxygenate the blood and the tissues a little bit more, sure, that will do that, right? But as far as regenerating nerves and muscles, we've seen proof that that can happen with lasers, but when you're dealing with a continuous laser, you really have to know what you're doing. You have to be like a mathematician. You have to measure the amount of joules it's outputting, right? And this is a 1-watt laser, so the treatments are long. They're gonna take a long time with this, okay? Put it in perspective, I take sometimes 20 minutes for a treatment, maybe more, and I'm using sometimes a 50-watt, sometimes a 25-watt, and sometimes a 15-watt laser. This is 1 watt. And in the manual, it says to treat for 15 minutes. I'm gonna assume each point for 15 minutes. That's a long time to treat. The higher the wattage, the more expensive the lasers are as well. And then also, we talked about having 808 and 650 nanometer lasers here. Mine goes up to the 900s, okay? Again, you get what you pay for. And when you get into 900, you're talking about laser diodes, okay? And that really starts to heal and repair soft tissue damage, can get down into the spine where the discs are, and also arthritis maybe for the spine. So if you're trying to treat a shoulder or the spine, something deep, or the neck, yes, you can use the acupuncture points they put here in the manual. I didn't find that they worked for me, and I held them for 15 minutes at a point, and I would wait till I had a stiff neck or something. And my neck, I have every disc in my neck herniated, spinal stenosis in my neck from car accidents and things that I've been in when I was younger. And I will tell you this, it's nice to have the 2 different laser. Too bad they don't do more of a mixture instead of 13 of the 650, that maybe split it up more evenly and add in some real laser diodes in there up in the 900 nanometer range, 910, so on. So I like this laser, but my other big issue is you have to be a mathematician to use this because it's a continuous laser. So yes, they tell you 15 minutes per point, but if you're treating a surface area like a knee, I use like take an apple, cut it in half, and that kind of surface area, that's the area you're treating, like sciatica, you know, right in your glute area and your lower back. Between that, that's about a good size apple surface area if you cut it in half. So you have to do all these measurements of power outage and joules, and it's a lot. It's complicated, and that's why I use personally super pulsed lasers. So there's my review on the LasePreht. We'll leave you some links in Amazon where you can purchase it, and any discounts where you can purchase it, and you may want to try to use it for your arthritis or your condition. But again, if you have arthritis deeper in a thick joint like the spine, and the spine actually depends on where the arthritis is, right? But remember, you got 5 layers of back muscle to go through. So be aware of that. Same thing with the shoulder, you know. It does tend to work better with thinner joints, especially if the laser is weaker. So the more wattage, the treatment times are shorter in duration. Hope that helps. Thanks for tuning in, and make sure you check out our other product reviews on lasers, and other healthcare products. I appreciate you all. Make sure you hit that thumbs up, and don't forget to subscribe if you haven't already done so. Thank you.